Hi everyone, today we are doing a full face neurotoxin treatment. So we are starting up on the frontalis. I personally like to work top down, but it really doesn't matter. It's just kind of provider preference. But we are just going in and treating. I've already marked up. So I am just making sure that I am treating the entirety of the frontalis. This patient I have been treating for quite a while now, so we already have her dosing down. And you can tell she has that beautiful glow from getting frequent neurotoxin as well. You can kind of see it when she shifted her forehead right there. That's just kind of a little example of how being consistent with your treatments can get you results. But now we're going in and treating our glabella. Here I'm starting off with her procerus. Since we have been doing frequent neurotoxin, we no longer treat her tails. She doesn't need it. As you can see, she is still pretty frozen. This is just atrophy from frequent treatments. She gets treated around every 3 to 4 months. Sometimes we do stretch it out just because she does tend to hold on to her product, which is good for her. She doesn't have to come in as frequently. Now we're moving on to her crow's feet. For this injection, I like to be superficial. I like to be able to see my blebs as I'm treating, and I'm always ensuring that I am facing away from her eye and staying superficial to avoid any complications. And I just make sure to come fully around wherever I see pull, kind of in a C formation, just following along her orbicularis oculi muscle. I do an injection point a little bit higher right there to give her a bit of a lateral lift on the tail of her eyebrow, and then just continue my treatment all the way along her crow's feet. And last one on this side, just again very superficial. The smile muscles, like our zygomatic major, connect on our zygoma, so just ensuring that we are always looking out for our anatomical positions. This is a brow lift for her, so just using my finger to kind of find where she pulls the strongest, and leaving my finger there just as a guide and placing my injection. That is again very superficial, just like the rest of her crow's feet as well. Here we're treating her nasalis. I like to have them make just a bunny nose and then go ahead and place my injection point. This is again very superficial. And this is a small muscle, so I always make sure, again, I'm using my anatomical positions. We treat her chin just for like orange peel texture, so I'm going about half needle depth here, right into her mentalis. Here we're treating her DAO, so I like to have the patient animate and pull down so I can find where they're the strongest. And if you can't really feel it, a good position is the oral commissure down and about a centimeter back. Right kind of along the oral commissure area where you can see that downturning start to occur. That's typically where our DAO is pulling. This patient also gets a lip flip. We just treat the upper lip for her. I do 3 injection points for her specifically, and she has a little bit of a scar on her upper lip, as you can see, so I just make sure to avoid that with my injections as well.